Peripheral giant cell granuloma, by Classic Dental. Content, introduction, clinical features, radiographic features, histologic features, treatment and prognosis. Introduction, peripheral giant cell granuloma, also known as peripheral giant cell epilis, peripheral giant cell reparative granuloma. Etiology, peripheral giant cell granuloma having unknown etiology, this lesion represents a reactive or neoplastic process. Epilis means only a growth on the gingiva. PGCP originates from the periodontal membrane or mucoperiosteum of the alveolar bone. Contributing factors for PGCP: local irritation due to dental plaque or calculus, periodontal disease, poor dental restorations, ill-fitting dental appliances or dental extractions, and chronic infection. Clinical features. This found in very young children as well as in dentulous or edentulous elderly persons, 4th to 6th decades of life. Females are affected almost 65%, twice as frequently as males, 35%. Same as central giant cell granuloma, CGCG. PGCP represent less than 10% of all hyperplastic gingival lesions. More common in the mandible than maxilla. Lesion asymptomatic and have a relatively rapid growth rate, often attaining a size of 1 cm within a few months. Clinical picture of peripheral giant cell granuloma. Peripheral giant cell granuloma is most commonly occurs on the gingiva or alveolar process, most frequently anterior to the molars, appear as dark red, vascular, or hemorrhagic in appearance, and it commonly exhibits surface ulceration. Edentulous patient, the lesion may appear sometimes as a vascular, ovoid, or fusiform swelling of the crest of the ridge, seldom over 1 to 2 cm in diameter. Ulceration is less common in the edentulous situation. Radiographic features. Peripheral giant cell granuloma may or may not exhibit evidence of involvement of the bone underlying the lesion. In edentulous areas, the peripheral giant cell granuloma characteristically exhibits superficial erosion of the bone with pathognomonic peripheral cuffing of the bone. Radiographic picture of peripheral giant cell granuloma. Histologic features. Peripheral giant cell granuloma consists of a non-encapsulated mass of tissue. It composed of a delicate reticular and fibrillary connective tissue stroma, it containing large numbers of ovoid or spindle-shaped young connective tissue cells and multinucleate giant cells. The giant cells in some instances resemble osteoclasts or sometimes larger than the typical osteoclast. Giant cells may contain few to several dozens of nuclei which may be large vesicular or small and pycnotic. Histologic picture of peripheral giant cell granuloma. In histologic picture of peripheral giant cell granuloma, we see capillaries around the periphery of the lesion. Giant cells sometimes may be found within the lumina of these vessels. The characteristic features of peripheral giant cell granuloma seen in histologic picture is foci of hemorrhage, with liberation of hemosiderin pigment and its subsequent ingestion by mononuclear phagocytes, and inflammatory cell infiltration. Spicules of newly formed osteoid or bone are often found scattered throughout the vascular and cellular fibrous lesion. Covering epithelium is mostly hyperplastic with occasional ulceration. Treatment and prognosis. Conservative excision is typically curative. Lesion must be completely removed to prevent recurrence. A recurrence rate of 10 to 15%. Prognosis is excellent.
Yeah.